Good morning. This is Dr. Bill White again with the American Orthodontic Society, and I would like to talk to you a little bit this morning about a, a two-phase case. It's something where you start the case quite young, whether in the mixed dentition, and you do a certain job or two jobs or whatever needs to be done, and then you stop, or you just kind of go along with a retainer on the a person, and then when they get all their permanent teeth in the mouth, you come in and finish the case up and do the second phase of the orthodontic case. And it's very important a lot of times to get this first section done. That saves a lot of things you may have to do in the second phase of it. Sometimes you just cut the whole second phase out, so that's fine too. Anyway, let's go and talk about this young man. He's got several other problems. Of course, the upper jaw didn't develop, and it is totally inside the lower jaw, or just fitting inside the cusp of the lower teeth there. Cross bites all the way around, and then it ends up class 3. So the guy sitting there like this, with his bottom teeth sticking out in front of this. It's a interesting case. If you don't do this young, then the child's jaw stays forward for years. It'll just be forward. It'll grow forward. Actually, the condyle kind of shifts back, and the gonial angle down here kind of flattens out, and the jaw stays out there as long as it's interdigitating. In other words, the teeth are just meeting together here real good. So let's look at this case, and if you understand these facts, it will be a very interesting case for you. Nice kid, and it's an excellent two-phase case. Now, starting off here, he's got a good vertical height of the face. So if he's a mouth breather, which it indicates that he is, and he's not developed real good right in this area of the nasal airway capacity, but that's not bad. He's a neat little kid, and we already had started in here expanding the upper arch here, trying to get it out over the lower, and he's grinning, and we kid the children and talk with them and everything, and make them feel comfortable there. And we'll look at the models, and you see his upper front teeth are fitting inside the lower, and he's got a crossbite, a pretty severe one over on the left side of the mouth. This is in crossbite too, but this upper molar ought to be out something like that, and fit over the lower like that. So we're going to start out early. Now he's got a lot of his deciduous teeth. In other words, he has his cuspids and his two molars all the way back here, cuspids and two molars. So we use all of these teeth in this procedure. We're going to expand and bring those deciduous teeth out and try to develop the airway a lot more in here when we do, and you'll see when we finish it, it is out there. Okay, on this side you see he's class 3-ish. This molar's way out front, and of course these teeth are out in front. These should be over here, and this tooth ought to be setting somewhere like in here, and it's out like that. So I know there's many of you know all this stuff, but a lot of people looking at this won't know that. So I want to kind of carry along with them, but I don't want to make it so dull you won't care about watching it. I hope it goes around, because there's some things in here that even people that are doing orthodontics for a good while won't know just really good. So you can spend a little time on it here. This is 1985, of course, when we're working on this young man, and he's got a good personality, and we enjoy working with him. Looks like he's chipped his 6-year molar back here in this area. And here's the 6-year molar on that side. Now this is the first and second deciduous molars over here on both sides. And then these are the deciduous cuspids. And we use all of these teeth in the expansion of the case. And as we expand the upper, we try to bring the deciduous teeth out, and they kind of carry the buds of the bicuspids out as they come out too. And then once we get the permanent teeth in and start the second phase, we go in and put this root torque, the buccal root torque, where you try to expand the roots out like this and have the teeth kind of angle in this form, the upper teeth coming down and the lower teeth hitting underneath them. We'll show you as we get there, and you try to bring the roots out. Now, if you are just expanding, that's what we're going to do with this upper arch, just expanding it. We put a large wire in there and just expand it. Well, that tends to bring the crowns out. They're in the air. They move a lot easier. And so we have to there's a rectangular wire under that wire, and it has this buccal root torque. In other words, if the roots are something like this, we want these roots to be out here, see? And so you have to take the arch wire that's coming through here, and you bend that wire down this way. And now you flex it up and put it in there, and that arch wire twists that. And we usually use progressive buccal root torque, where you grab the arch wire right behind the cuspid teeth, and then you get out on the end and you twist the thing this way. In other words, it's kind of going like that. I don't know whether you can see this on the video, but it'll be turning like that. And you flex it and put it in there. Now, if you've got something that'll support it and keep it out, it'll give you buccal root torque. But if you put that on there and there's nothing in there other than the arch wire to support it, the crown will go in. In other words, you'll get lingual crown torque instead of buccal root torque, and it'll be right opposite of what you want. So you've got to have something to support it. We take the arch wire always and expand it once you do the buccal root torque. So the arch wire is trying to bring it out there, but the torque will overpower the ability of that arch wire to expand out. In other words, you could have it way out here and it'll still bring it in. The torque will bring it in. So we'll try to explain that a little bit more down the line here. I don't want to spend all day trying to show that point. Now this is the cephalometric after we had started. Now see, we've expanded and we've got these teeth laying out like that. Now we don't want to leave these teeth with this type of torque. We want to bring the roots of the teeth forward in here. Now I didn't use a lip bumper on this case, but it is good to take a lip bumper and run interference for it like that, and then you put torque in these and try to bring these roots out. Now that pulls the crown back where it was, so you have to hold it out there to do that. So sometimes we have to wear reverse headgear and pull this out and bring it to this point. Sometimes now they go in and put some screws up in the roofs of the mouth and push against those screws to keep this from going back, so the roots of the centrals and laterals come out this way. And then the cuspids don't normally have any torque coming to the buccal, but they are tipped in here. And so you have to have this tip in the cuspids, or you need to have it in there. So we'll talk about that. This is what makes orthodontics, where you have to stop and really think to see what you want to do in here. Now, these panrexes I've got here, this is the first one we took, and this is going to be a two-phase case, and we've got all these deciduous cuspid and the two deciduous molars on both sides right in here. And so when we start early to go in and expand this, where we've got the young man sticking his chin out like this, we're going to expand these upper teeth where they come over the lower teeth. And that's the way they ought to be. So that catches the cheek and keeps you from biting your cheek. And then it allows you to chew better. And you can glide your teeth or just work back and forth in there. And grinding food up with your jaw like this is about 4 times more efficient than if you've got a real deep bite and you can't do this at all, and your lower teeth are up in the roof of your mouth. The only way you chew like this. Now that's the way a dog chews, and this is the way a cow. Not that I'm saying it's better to be the cow type. It is as far as grinding the food up, and you can chew your food up so much better if your jaws are more or less level. You don't have a deep bite. You can have a certain amount of that and it doesn't bother at all. Okay, let's get on down the way here. Here is the cephalometric, the panrex that we took second in this case, and you can see we have bracketed the deciduous teeth along with the 6-year molar and the permanent front teeth here. We bracketed them and we're expanding that. We're just expanding to get the upper teeth over the lower teeth in that way. We're definitely not expanding the lower down here, but anyway, we use those deciduous teeth to help in this expansion, and that's perfectly legitimate. All right, now, however, in some areas I've been places where orthodontic department was teaching not to touch, not to mess with the deciduous teeth at all, but you really should use them, and it doesn't hurt if the bone completely goes away on them. I showed you some on one of the cases where we just flipped them out like that. So here this is starting, and this is the early part of it, and we do the second phase now when these bicuspids, or nearly all the bicuspids, and of course the cuspid will be coming in too with it. So you want to do that. You go into the second phase when you get most of your permanent teeth in the mouth. All right, here's here he's grown now, or he's at least, he's 12 years old and 4 months, and he's got all of his permanent teeth. So we have started and we're working in the second phase of the treatment here. We took it off and left it for a while. See, it's 1990 now, and we started out in 1985, about 86, 87, somewhere in there. We put him in a retainer. Maybe it was 88, I don't know. And then come about 90 something there, we started his second phase. So this is in the second phase here now. So it looks a lot better. Now this is he's 13 and 1 here, and we're finished working on him, and we've got the teeth all lined up. I have him biting forward, you see, in here, and you see this molar now is like that, and that's the way they should fit together. The mesial buccal cusp of the lower fits up in this groove between the first molar and the second bicuspid, right in that, and it fits good. This one is slightly class 3. You see, this ought to be back further in there. We've got him lined up pretty good out there at the front, but it's not perfect. All right, this is 1991. All right, here we are starting out, and this is 1985. See, we're going to push these together. Well, we've already done it. You saw what they look like in their models. All these teeth, everything was behind. So we've already expanded the lower arch there. I mean the upper arch, and got it over the lower arch. Okay, I'll rush on through here. And we had some expansion springs or loops in the wire. See right here, this goes up and you condense it so it's pushing out on this. It brings that forward. Now here it's 1986, and this 9 of 1986, maybe when we took him out and put a retainer. This is 9 of 86. We finished expansion. We did the thing that we went in to do in the first phase and got him out there, and we put a retainer, and he wears that retainer. We keep an eye on it, and he may lose these teeth gradually as they come in. We can hollow out and make place for the teeth to come in. And so you just kind of wait it out on this until he gets the teeth in there. Now here is the arch, but these are deciduous teeth now. And so we have developed this arch out like that, where before it fit inside the lower arch right here. So we got it out there in 86, and then he didn't get the permanent teeth in here till about 90. See, so you got 86, or probably later in 86, but you got about 3.5, and maybe 4 years that you just watch it retainer and you get the teeth in there. Then you come in and do the second phase of the treatment. This is why pediatric dentists ought to do this. That really is something they should do. It's hard for an orthodontist with a big, busy practice to keep up with that. And the way the pediatric dentists now, some of them are just afraid to go in there and do any orthodontics, which I have no idea how they could be that way. I'm certainly not. And they should be doing this. And the orthodontist should be welcoming them to do that, and see all this stuff. Now, and as far as treating this type of stuff with these plastic shells, that's just absolute ridiculous to think about going in here. You'd have to make, I don't know how many to do it, and it still wouldn't be. So I'm not pushing that at all. All right, here we've got the teeth over the hump, but they need to be torqued in quite a bit, and there's an awful lot of torque in those upper anterior teeth. And this is in 86, probably the latter part of 86. And here's the young man. Now he's a little older, and he's got his teeth out there with a retainer in, and so this is, no, let's see now, this is 90. So we're actually getting started with the second part in this part of the case. You can remember how this is when we get through this. Now, all right, this is January of 89, and the permanent teeth are in the mouth now, and we started the second phase of the treatment. Now, a lot of people want us, well, when do you do the first phase? When do you do the second phase? You do the first phase just as quick as you can possibly do that, and then you come, in other words, it depends on what needs to be done, of course, as to the time you do it. So a lot of things that you see, you do them just as quick as you can see them and get the child where they can take care of it. All right, now we're going to start this second phase. We've got the permanent teeth in the mouth, and we're going to finish this out and hopefully get it looking great. All right, this is just some different views of it. And this is 89, and we'll change the torque in that. All right, let me run through a little bit more of this. Now, we got to the point in the upper where we're in the second phase, and we needed to expand the upper arch even more to have it lap over the lower arch. So we came in and put this large arch wire. I think that's an 036 arch wire. It's not an 040, and it'll be bent way out here somewhere on the, and they'll have to condense it to tie it in. And so the rectangular wire that's in the brackets in there, we're going to put buccal root torque in the rectangular wire. Now, if your bracket slot, I'm going to just represent that by my fingers here, and this would be the arch wire right beside it that fit in there and hold it that way. But we want to make it do this, and you can just see, you can figure out what the torque will be. So you've got to twist this wire like this. Now you catch it up there around the cuspid, and get with one plier and go back and catch the other end, and you twist the dickens out of that wire. And so when you get through, it does like this, you see. So you got more torque back at the back of the wire on the molars than you do up here at the front of the twist. It'll be on the bicuspids. The cuspid now, you just leave it. You don't try to torque it out like that, but you do the bicuspids and then the molars. You'll torque the roots out. And that's what will be going on here. As we expand the crowns, in other words, they're moving out in this direction. If you don't do that, and you put this buccal root torque in it, it'll bring the crowns in instead of out like you want. The torque will overpower the expansion power of the arch wire, but not this large wire here. It'll keep it out there, and it'll torque anything you want to. Okay, maybe that helps you understand it a little bit. Now, there's a lot of these. I've got 2 or 3 pictures here that I wanted to show, but this was made back when we had to take the pictures and send them in, and once you got them, you had them. That's all it was. Now, here is the rectangular wire that's in the mouth now, and this is the Big Daddy, what we call it. People just named it that, and you have to pull it in and hook it to these teeth to get it through. And this was in 1990. So we go through it, and now the kid just flat dab didn't brush his teeth good, not or hardly at all as far as you look at him there. And good kid, and you want to just whack him over the head with something to make him brush the teeth like that. But this is when he's about finished, you see, and he's just neglecting them. And we've still got these on. We haven't put the 3 to 3 on the back side yet. Okay. Here is the upper retainer. Now holding it with a bite plate. And, well, let me show this is the bite plate. You can hardly see it in here. But it's in there. We had him bite to it. It leaves a track in the acrylic while it's setting up. Okay. Now, all right. Here is where he was when we started. On the right side, it wasn't as class 3 as the left side. But it's in a crossbite, and it's in a crossbite in the anterior. And here's where we finished up in 91. And this is the anterior part where it's behind the lower. And here we've got it out over the lower teeth. And the cuspids are coming in right in here. And you don't want any kind of retainer that has anything in between the teeth, you see, because you want the teeth to come together and kind of wear in. They just actually, and you finish a case and you put them where the teeth can come down and wear in like that, and then a couple of months later you look at it and they're just so tight and they fit down in there better and help hold each other in place. So here it is to finish, and you can see where we were here. This was more class 3. See this molar way out here, this one out in front of that, and this was just too much torque, So here he is after we got through with the case, and this is the retainer, and you can see that bite plate on it. Now this guy's teeth are in good position, but back there on one of those x-rays, the x-rays went all the way through too. He's got some wisdom teeth coming in, and you really want to keep an eye on them. If he develops more jaw, which he may back in this area, then he may have room for these wisdom teeth as he gets older, and a lot of young men do, but he may not, and you have to keep an eye on it and get those wisdom teeth out if there is no room for the wisdom teeth in there. If there is room, keep them, man, because you can fill in gaps up above 15, 20, 30, 40 years later if you've got a wisdom tooth to slide into the place like that. All right, that's the last picture I've got of him. This is just the earlier picture. I appreciate your watching,